My name is Allison Krefetz, and I'm doing my persuasive speech on organ donation. Why we need more organ donors. First, I'm just going to pan the room for my audience here. Okay. We need more organ donors. It's that basic. In these times of modern medicine, even with all the amazing medical advances that have been made over the years, we still have not been able to replace the need for the ultimate gift any person can give, the gift of themselves, the gift of their organs. I will not try to tell you it's a pleasant topic. I won't say that I'm not surprised when people don't really want to be organ donors, or they say they aren't involved in this. Most people who aren't involved in the medical field only ever touch on the subject when they get their driver's license. The nice man behind the desk asks, "Are you an organ donor?" No pamphlet on why you should or shouldn't, just the question. But if we really learn one thing from our topic today, if we just keep our options open, so many lives could potentially be saved by being informed. Myth number 1 from the mayoclinic.org is that if I agree to donate my organs, my doctors in the emergency room really won't work as hard to save my life. They'll remove my organs as soon as possible to save somebody else. The reality, when you go to the hospital for treatment, doctors focus on saving your life, not somebody else's. You'll be seen by a doctor whose specialty most closely matches your particular emergency. The doctor in charge of your care has nothing to do with transplantation. But I've actually been there. I know firsthand there is a need for more people to make the generous decision to donate their organs and impact many lives. I have harvested multiple organs and seen the difference it can make in the people's lives. I have taken the technically living donors away from their families, so distraught as we went down the hall to the OR. I have harvested the term we use for taken organs such as skin and bone from already pronounced deceased patients. And I have also taken a kidney from a living son in one OR and walked it across the hall to another OR to be implanted into his father to save his life. Organ donation is the single most generous act I have ever witnessed. It is always a bittersweet situation. In almost all cases, someone must die so another can live. mayoclinic.org myth number 2. Maybe I won't really be dead when they sign my death certificate. It'll be too late for me if they've taken my organs for transplantation. I might have otherwise recovered. Reality, although it's a popular topic in the tabloids, in reality, people don't start to wiggle a toe after they're declared dead. In fact, people who have agreed to organ donation are given more tests to determine if they are truly dead than those who haven't agreed to organ donation. For someone to be a donor when they are still breathing by means of a mechanical ventilator, they must be brain dead. You can't be a donor if you're just bleeding internally, or if you're unconscious, but brain activity still allows you to breathe on your own. Brain death means that you are not able to take a breath without the assistance of a ventilator. There is nothing in your head making your body instinctively just fight for life. Brain death, in the simplest terms, mean the brain has permanently stopped working. Brain death, when the brain dies due to lack of blood and oxygen, is a medically, legally, and morally accepted determination of death. A series of tests administered by a physician will determine the loss of brain functions. Artificial support systems may maintain functions such as heartbeat and respirations for a few days, but not permanently. In the April 1999 issue of Critical Care Nurses, we learned that to determine brain death, more than one diagnosis of brain death and a series of tests over a period of time are required before the donor's family is presented with the opportunity to donate. And according to organdonor.gov, there are 105,081 people waiting for organs as of November 23, 2009. For every 77 people a day that receive organs, there are 1,000 that never get a call for a match. Here's another myth. I'm not in the greatest health. My eyesight is poor, Nobody would want my organs or tissues. In reality, very few medical conditions automatically disqualify you from donating organs. The decision to use an organ is based on strict medical criteria. It may turn out that certain organs are not suitable for transplantation, but other organs and tissues may be fine. Don't disqualify yourself prematurely. Only medical professionals at the time of your death can determine whether your organs are suitable for transplantation. And just as a side, more than half of the national transplant waiting list is made up of multicultural populations. That's because some of the diseases of the kidneys, heart, lung, pancreas, and liver that are best treated through transplantation are found more frequently in these populations. For example, African Americans and other minorities are 3 times more likely to suffer from end-stage renal disease than Caucasians. And although it is possible for a candidate to match a donor from another racial or ethnic group, transplant success rates increase when the organs are matched between members of the same ethnic background. Consequently, a lack of organs donated by multicultural populations can contribute to the longer waiting periods for transplantation. Talk to your family, dispel the myths, and become an organ donor. We need everyone to be educators and to help take the misconceptions away from organ donation. If we can learn about this option outside of a tragic situation, we can make better choices for our families. We need to remember that the stars have to almost align in order for your death to result in you being able to be an organ donor. Of all the deaths in the United States, only 1 to 2% have the potential to result in organ donation. Unfortunately, only about 50% of those people actually donate. If everyone who could donate said yes, the waiting list for transplants would be greatly reduced. There is almost always a tragedy associated with someone being a candidate to be an organ donor. It is extremely difficult to say yes to making your loved one a donor in the midst of a devastating car accident or any tragic event. But we need to look at it another way. Imagine you have a beautiful, healthy son or daughter. One day, like all kids do, they get a virus. But this virus is different. It attacks their heart and lungs in a devastating way. You are told that they are in need of new organs quickly or there will be no hope. This is not a situation that anyone is ever prepared for. Sadly, if there are not organs that match available, their hopes and dreams of becoming parents, having careers, or growing to experience life is over. You find yourself in an almost hopeless situation. We must try to put ourselves in these horrible shoes when we choose to be or not to be an organ donor. So who can help? All people of all ages should consider themselves potential organ and tissue donors. There are a few absolute exclusions: HIV positive, active cancer, and systemic infections, and no strict upper or lower age limits. Potential donors will be evaluated for suitability when the occasion arises, and you are never too old. No one is too old or too young. Both newborns and senior citizens have been organ donors. The condition of your organs is more important than your age. Someone 35 years old with a history of alcohol abuse may have a liver worse condition than someone 60 years old who has never consumed alcohol. In addition, people on the waiting list might need to be transplanted with an organ that is less than ideal if there are no other suitable organs available in time to save their lives. Doctors will examine your organs and determine whether they are suitable for donation if the situation arises. If you are under 18, you will need the permission of a parent or guardian to donate. And if you have serious medical conditions, please don't rule yourself out. You may still be able to donate your organs. Doctors will evaluate the condition of your organs when the time arises. The transplant team's decision will be based on a combination of factors, such as the type of illness you have had, your physical condition at the time of your death, and the types of organs and tissues that will be donated. Please discuss so they know your wishes in case of an accident. The Gift of Life organization tells us some steps we can take to help our family. If you have not made a personal pledge to be a donor, consider doing the following. Number 1, talk to your family and friends about your decision. Make sure they understand that you have a decision to be a donor or not. Sign and carry a gift document. This can be designation on your driver's license, a state ID, or a living will, which clearly states your donation wishes. Number 3, if you use a living will, include your family members as witnesses so they are informed of your desire to donate. Without question, making a decision about organ donation and tissue donation can be difficult because it requires us to consider our own mortality and to talk about death and dying. However, many people have gained some degree of comfort by informing loved ones of their decision so that the burden of making decision will not be placed on our family members. I have seen both sides. I am an organ donor, and I hope you will consider it also. Thank you.